Here's the 30-second lesson on what legends know. Never practice nunchucks in a crowded room. Never eat chole before a road trip. Always take your shirt off before you iron it. Don't take a call near a swimming pool. And don't forget, saving is not investing. Legends don't just save, they invest in mutual funds. Mutual fund investments are subject to market risks. Read all scheme-related documents carefully.
It is too often said that good news is not a story. Good news is no news. Bad news is a story. Man bites dog is a story. However, that is not quite true. What is new, what is different is news. And when it's good news, it actually lifts you up. Particularly if it's good news in an area which is also non-polarized and non-polarizable. Because in our politics also, given how polarized and divided everything is, it becomes very difficult to find areas where you can see good news without any controversy or without any mocking, etc. However, one of those opportunities has arisen today, and that's the reason you can see me smiling. And that opportunity is a very substantive publication, a paper in Nature, the journal, that shows the beneficial effect of Swachh Bharat Mission. Now, Swachh Bharat Mission, as this paper describes it, is probably among the largest public health initiatives taken by any government, any large country in the past many decades. I am not taking you back to what Chinese might have done in the past, but they did it a long time back and got done with it. India, however, started this massive toilet building and Swachh Bharat sanitation program in 2014. As this paper in Nature estimates, its cost between 2014 and 2020, its cost an average, just the toilet building, mostly the toilet building, has cost an average of the equivalent of $1.2 billion a year. It is an average, so some years will be high, some years will be low, but $1.2 billion a year. If so, this was money well spent. That is what this data tells us. This paper is with me. I am sharing a link with you. You can go over it. Statistical methods. It's a bit Greek and Latin for me, so I will not even try to declutter it for you because I don't understand it. It's very impressive. That's all I can say. These are substantive scholars who've written this, substantive scholars working for a credible organization. Most of them are working for IFPRI, which is International Food Policy Research Institute based in Washington. Some are from public health departments of reputed universities in the US. Most of the data they've taken is from publicly available Indian government data. Some of it is from National Family Health Survey, Phase 4 and 5 that we have spoken about in the past. Some of it comes from the basic rural level data capturing that's done by every district in India. That is the Vital Registration System, or VRS, which is affiliated or which is done by the Census Bureau. All the data comes through the Census Bureau. And then there is the district level household survey, DLHHS, in addition to NFHS, which is seen to be quite credible. So you see all that data. So what have these researchers or authors of this paper done? That is Suman Chakravarti and Soira Gune from IFPRI, Suman Chakravarti in Washington, Soira Gune in New Delhi, then Tim Bruckner from University of California, Irvine, Julie Strominger and Parvati Singh from Department of Epidemiology, College of Public Health, Ohio State University. This is a collaborative study. They call it a quasi-experimental study design. What that means is they haven't picked up any data of their own, they haven't carried out a survey of their own or done control groups, etc. They've taken available survey data from Government of India sources and extrapolated then again various factors. That is mortality rate data, and also the toilet building data. And that is how they've arrived at these conclusions. They argue in the paper that it's a very robust methodology that they've followed. What is the basic highlight of the data? And the main reason that should make us smile is that wherever more than 30% new toilets have been built under Swachh Bharat Mission, I would presume that is 30% over what was already existing. their infant mortality rate has gone down by a factor of 5.3. What that means is that infant mortality rate, which is the number of babies who die, the number of live babies, babies who are born live but die within their first year, that death figure has declined by 5.3 per thousand, only attributable to Swachh Bharat Mission toilets. We need to understand this better. I'm trying to simplify it. That's my job in Karta Clutter. It's a challenge sometimes, particularly when it comes to complex statistics. If you look at India's infant mortality data, simply IMR, that is live babies born who will die within first year of being born. In 2003, for example, a majority of Indian districts had an infant mortality rate exceeding 60 per 1000 live births. That means 60 out of 1000 babies born live would die within the first year, would not survive the first year. A majority of the districts had average exceeding 60, but there was a mean of 48.9. So nationally, in these 35 states and union territories, 48.9, that's almost 50% of the babies born would die within the first year. So, for example, now the latest data says that about 2.5 crore babies are born in India every year, 25 million. So, if you apply the same standard there, the equation of 48.9 per thousand, you can see that almost 12.5 lakh of these babies, 12.5 lakh of these 2.5 crore or 25 million babies would have died within the first year if this was 2003. However, the situation has changed dramatically. India's infant mortality rate and also mortality rate of babies under the age of 5, up to the age of 5, have been falling. So the overall fall for IMR, infant mortality rate, between 2003 and 2020 is dramatic. So if the mean in 2003 was 48.9 per thousand, the mean in 2020 was 23.5. That's less than a half. In fact, even for districts, a large number of districts that had more than 60% in 2003, now that large number of districts is a little bit more than 30%. So that has halved, whereas the mean has more than halved. Now this is halved because of many factors: improved immunization, more deliveries in medically controlled conditions, more deliveries in hospitals, more deliveries by qualified medical personnel, better hygiene, sanitation, disinfection at the time of delivery. All those things matter. So how do you arrive at the conclusion that a certain percentage of reduction of this infant mortality is attributable to the building of new toilets, particularly under Swachh Bharat Mission starting 2014. That is what this study has done by extrapolating this data, looking at data of infant mortality, under 5 mortality, all the other factors including vaccination, etc. And then the pace and numbers of toilet building in the districts. If you see all that, then the conclusion is, and it's a very important conclusion, then the conclusion is that if any district, more than 30% additional toilets have been added through Swachh Bharat Mission. In fact, the study says that in 2003, less than 40% of India was covered by toilets, and between 2003 and 8 and up to 14, there wasn't much improvement. If anything, there was some deterioration, right? After 2014, toilet building built up at a dramatic pace. I told you $1.2 billion per year. 2nd October 2014, Prime Minister Modi declared this as a national mission or a Jan Andolan, people's movement. Now, if those toilets, 30% more toilets were added in a district, it led to 5.3 per thousand reduction in infant mortality rate and 6.8 per thousand reduction in under 5 mortality rate. For example, you can see that infant mortality has fallen from 48.9, a mean of 48.9 in 2003 to 23.5 in 2020. Now that reduction of 25.4 percentage points, of that you can see that 5.3 percentage points is attributable to this toilet building. That is if only 30% more toilets were built. In many districts, many more than that toilets have been built. In fact, I will share with you some data and also figures from the paper giving us an idea of where more toilets have been built and what is the impact. And you can see almost a direct correlation between the building of toilets, number of toilets built, and reduction of infant mortality. And the researchers, based on their conclusions, also looking at India's net birth rate, etc., they've arrived at a conclusion. And I quote from the report, it says, based on our regression estimates, the provision of toilets at scale, so these are toilets at scale, may have contributed to saving 60 to 70,000 lives annually. That's a lot of human beings, because if no human being should die so early in life, all of us will die eventually, but no human being should die so early in life just because there was not enough nutrition or not enough medical care, or the childbirth took place in infected conditions, or there was malnourishment, or there was malnourishment going up to the age of 5. A lot of that is attributable to lack of sanitation, and lack of toilets or open defecation is a very central factor there, because lack of sanitation is also an important factor in child stunting, that is children being below the expected height, and child wasting, that is children being below the expected weight. In fact, those are the factors that give India such a bad ranking in what is called as a global hunger index. And I've said often enough that global hunger index, to call it global hunger index is a clickbait, because that really is not a global hunger index which suggests that people are starving. No, that's not true. What that data tells us is the quality of nutrition that your people are getting, because the basic factors there are child stunting, child wasting, etc., and there sanitation plays a central role. And that's where the researchers talk about the Asian enigma. And what is the Asian enigma? That economic condition of people is improving. In India, economic growth has now taken place for 30 years at a fairly good rate for the past many years, among the top 3 countries in the world at this point, the fastest growing large economy in the world, and looks like it will be so for some time. But in spite of that, many of these human development indicators, particularly to do with babies and small children, haven't improved. What is that paradox? That is called the Asian enigma by these researchers. And a presumption is that one of the reasons this Asian enigma exists, one of the explanations for this Asian enigma is open defecation, because large parts of India have had the problem of open defecation. And open defecation then has many consequences. In many cases, children, parents also go out on bare feet to the fields to defecate. There is also lack of hygiene. So you have fecal oral infection, repeated rounds of dehydration and malabsorption, and in the course of time can also cause chronic inflammation of small intestines. And that is what has terrible deleterious effect on the future of children as well. Many of those things are linked to open defecation. So once open defecation comes down, many other virtuous outcomes follow. And that is the benefit that India's babies and small children seems to be getting now. And that's the reason we can say, and that's something I believe in, that this massive nationwide toilet building on mission mode has been the Modi government's most substantive, most virtuous, least controversial, and I would say the most consequential initiative in the past 10 years, and this data is proving that to us. Now, the paper tells you that in this period, 2014 to 20, remember the mission has gone on for 4 more years after that, so we must have got more benefits after that as well. By 2020, in 6 years, over 100 million toilets were built. In fact, later they give a figure of 109 million, that is 10.9 crore toilets have been built, and 6 lakh or more than 6 lakh villages have been declared open defecation free. Now, I know that you can always go someplace and say this toilet is not working, or I found some bad stuff lying outside in the field. Oh, see, people are still going out. So nothing is 100%. But remember something that we keep saying all the time, perfect is not the enemy of good. I would actually modify it, and I would say perfect is not the enemy of the better. So things have gotten a lot better. Even when you walk through the countryside, you walk through the poorest parts of India, which I do often during elections, in different parts of the country, you can see it is quite evident that evening time, if you went for a walk, even if you were driving on a village road with windows open, after sunset, just after sunset, you could smell open defecation. That smell is no longer there. That's a big substantive change. And the fact somebody might say, no, 11 crore toilets were not built, only 8 crores were built. That might be the case, but it does not change the basic big picture. At which point I bring in some of the key graphics from this research paper. So see the first graphic. This first graphic tells you that there's been a secular decline in infant mortality rate. That means every state, in every category, every district has seen a decline between 2003 and 2020. Now, the important thing is to understand color coding, because I will share a bunch of graphics with you. Sometimes darker is bad, sometimes darker is good. So, the first set of pictures, you will see 4 pictures. This is the map of India. This is for 2003, 2008, 2015, 2020. See, all 4 will come up on your screen. Darker in this case is worse. So 2003, the country's states, most of the states are much darker, and each subsequent stop, 2003 to 8 to 15 to 20, the color has become lighter. But once again, you can see something very important. You can see where it remains still darker than the rest and where it becomes lighter. So it is basically in the Hindi heartland, what is called as the Hindi heartland, that this color is the darkest. That means they had the highest infant mortality rate earlier. Their rate is still higher than many coastal states, in fact, even northeastern states. But at the same time, because of where they started, the improvement there is very substantive, maybe even more substantive than it was, say, in Kerala, because Kerala, even to begin with, was quite light. It had very low infant mortality rate. So these figures, these maps tell you that story. In this case, remember, darker is better. So that's the key thing. Darker is better. This is any toilet access percentage. So see 2003, most of the country is quite light, which means most of the country is short of toilets. Then as you go ahead, 2008, not much improvement, unfortunately. 2015 also a little improvement in the very north of India, maybe a little bit in Gujarat, not very much where India's population mass lives, that is the Hindi heartland. 2020, the entire country has gone into a much darker shades, or many darker shades of the same color. That tells you the story of this massive toilet building, because I told you in the second set of graphics, darker is better. So the darker it is, it shows more toilets built, and you can again see on this map which states have seen more new toilets built. Again, for clarity, see this set of maps, these are again maps of India, and these now go from year to year since Swachh Bharat Mission started 15, 16, 17, 18, 19, 20, and once again darker is better. And you can see how Swachh Bharat Mission coverage has increased from year to year to year. See where we were in 2015 and where we are in 2020. This is a very instructive graphic, so I thought I will share it with you. Thank you, authors, because we've borrowed these from them. And then one more graphic, which in the paper is figure number 6, but we are just picking it up at random, leaving out some of the others, more complex ones, which are statistical and difficult to explain. Experts will understand that, but this one is indicative and I think quite interesting. This is plotting the increase in Swachh Bharat coverage. So you see 0%, 10%, 20%, 30%, 40%, 50% like this, and the predicted infant deaths. So the first picture, in this case, the first graphic, the first chart is predicted infant deaths, that is up to the age of 1, and second, predicted under 5 deaths. And you can see that there is an inverse relationship between the building of more Swachh Bharat Mission toilets and mortality rates. It's a direct correlation, a straight line, a straight declining line. This is as good an evidence as you can find of the fact that Swachh Bharat Mission, the building of the toilets, this massive building of the toilets under it, has been one of the most transformational initiatives in India. So credit where it's due to Modi government, to Prime Minister who thought of this idea and drove the country in this direction. Also people who worked on the project. Remember Parmeshwaran Iyer, who's now back at World Bank, who came in from World Bank to run this project, the team under him, all of them have done a marvelous job, and the results, we always talk about the theory of unintended consequences in a negative way, that if you do this, you don't know what a terrible thing will happen. But the theory of unintended consequences also applies in a good way. So in a good way, you get cleanliness, you get better health, but you also get lesser infant mortality. So a good initiative like this, a good energetic initiative like this, behind which you put so much money and emotion, that is a gift that keeps giving, because you will keep discovering benefits that accrue to us as a society and the country over time. And maybe many of those were benefits that were not imagined when this scheme was launched.